Today I'm going to start with a presentation about our experience in Catalonia using the Sirocco model to measure the integrated care deployment in residential care during the COVID pandemic. And after, as Tina said, my colleague Joan Carles will talk about the current situation and the agenda on integrated care in Catalonia. So some context. When the COVID pandemic broke out, it hit very hard the nursing homes in Catalonia. And as you can see, we in the peak of the first wave, we had 554 daily confirmed cases, 555 daily hospitalization, and we had almost 200 deaths of people from nursing homes in a day. So this is just so you can picture the magnitude of the tragedy in nursing homes that brought an intensification of the collaboration between the health department and the social affairs department. So seeing that this new collaboration between departments was bringing changes in the residential care area, we thought that it was necessary to measure the situation of integrated care in this area. And we thought that the Sirocco model was a good tool for this because it allowed to combine a quantitative and a qualitative analysis. So first with an individual survey, where we asked the participants about the pre-pandemic and the current situation. And second, with the consensus sessions, where the participants only discussed about the current situation. And we kept, for the qualitative analysis, all the information about the arguments given on the debate. It was a year ago now, and more than around 190 professionals with different profiles and responsibilities, and they were distributed in 18 territorial, multidisciplinary territorial teams. So next slide, please. Related to the adaptations to the survey, I have to say that we made very little changes in the survey because really Sirocco maturity model has a great adaptability to the nursing homes reality. So as I said, very little changes in the survey, very few changes on the text in the survey, and with the only objective to focus the participants' attention in some aspects. The most important change was the introduction of the pre-pandemic situation in the individual survey, so we could have a picture of the situation in that moment to measure the impact of the pandemic on integrated care in the residential area. So here on the left, in the green circle, you can see that breadth of ambition is the highest score dimension in both 2020 and 2021. With red circles, you have the dimensions with the lowest scores in 2021. And with blue circles, you can see the dimensions that have improved the most their scores from 2020 to 2021. They are the same as the four first dimensions on the graphic on the right side that shows the variation of the scores between 2020 and 2021 in each dimension. This big impact that we see here is one of the main findings, and it was a surprise for us, not to see an improvement, but its magnitude. Next slide, please. Here you see how the different professional profiles scored the different dimensions. The lowest score dimensions are funding and removal of inhibitors. Next slide. And the highest score dimension is breadth of ambition. You can also see that the most homogeneously scored dimensions are citizen empowerment and innovation management. Next, please. So this is the result of a territorial team after the analysis of individual survey and the consensus session. So watching at the orange line in one another, we could see if the consensus session made the participants change their minds about one or another dimension. Comparing the results of the consensus sessions, so more than 75 of the territorial teams agree in their scores on readiness to change, structure and governance, digital infrastructure, and removal of inhibitors. And more than 50% agree in process coordination, funding, population approach, citizen empowerment, and innovation management. Next, please. After the consensus session, it was time for the qualitative analysis of the discussion and the arguments given on the debate. And the main ideas that resulted from this analysis for each dimension are that there is a resistance to change because of the fear of nursing homes of being transformed in health centers. The pandemic has brought some changes, but now a strategic planning is required. Next, please. That it is necessary to formalize and regulate informal agreements and alliances. Next, it is important also that the coexistence of two systems requires an interoperability between both, so the health and the residential care record. The need for new joint protocols beyond the pandemic, the good impact of new primary care case managers, the need for a new funding model to encourage transformation, and that the new funding scheme should improve labor conditions of nursing workforce. Prioritization of actions should be implemented. Next, the great potential to aggregate and perform joint analysis of data from both health and social care sectors. It was also important that real co-creation dynamics should be encouraged. And next, yeah. So one important thing, it was also that it is required an integrated information scheme to evaluate integrated care system. And next, very important, that integrated care now focused on in residential care should spread to other sectors like home care. And in the last innovation management, the pandemic has contributed with good learning by doing, but in the future, innovation should be planned and protected. And in the last dimension, the understanding of social care services in the health sector should be encouraged. Next, please. Not related to a specific dimension, but it was important also that a lot of participants felt some kind of uncertainty about the integrated care real progress after the pandemic crisis scenario. And from my side, that's all. And thank you for your attention. And I let Joan Carles talk about integrated care in Catalonia. Thank you.